Today you're watching low back pain stretches and exercises for phase 2. At this point in care, you're already feeling better, and we have actually given you a prescription to move forward with your stretching and progress because you're doing well. So with phase 2, we're still going to need a lacrosse ball. We're now going to need you to get a resistance band from the front desk. They'll supply you with one, and you're going to need that small ball that I recommended on phase 1. So we're going to start out with the ball, and she's going to do exactly the same stuff that I told you in phase 1 for mobility using the ball. All of those continue to be the same. Now from here, she's going to progress. So she's going to take the ball and she's going to put it right on underneath the glute muscle, and she's going to target the piriformis and glute. And she's going to lean into that, and she can pull her knee up towards her stomach. Pull that right knee up towards your stomach. And she's going to allows it to dig in a little deeper and hit that spot we've been working on. So from here, she's then going to remove the ball and she's going to go to her back. So go ahead and lay on your back for me. The ball is going to go back in the same spot into that glute, and she's going to now work range of motion of the hips side to side. If you want to kill two birds with one stone, you can put the ball on the other side too, but really unilaterally targeted, the one that's hurting you is priority. Side to side. There should be no pain other than where the ball is digging into the soft tissue. And again, don't put it on a bone. She's going to also do that with the low back. So she's going to put the ball right on the low back, and because this is phase 2, your tissue is now a little bit more supple. You're going to do this on the floor in front of your couch. The legs are going to come up, which is going to flatten that spine, and it's going to allow the ball to go in. Your legs are going to be resting nicely just on the couch, just like this, and it's going to allow it to sink in. So then she's able to kind of move the hips back and forth as she's on the couch, trying to dig in deeper. After she removes that, we're going to go ahead and go right into the marches that we were doing before. So in phase 1, we were keeping the knees bent. Phase 2, we're going to drop this down. She's going to take her right arm above her head. Left knee's coming up. Core is going to be strong and engaged. Glutes are going to be firing, and she's going to come back down. Go ahead, other direction. And it's opposite knee, opposite arm. 10 on each side. And drop your foot all the way down and rest it again. So she was holding it up, which is going to be phase 3. But for phase 2, we want to do this. After we have activated this, we're then going to go into 7 steps. So I'd like you to stop watching at this point in time and turn to 7 steps. Or you can continue watching, and I'm going to show you how to use the band. A quicker version, if you need more education, go to the next video of 7 steps. She's going to wrap this around her waist, so go ahead and raise up. She's going to bend one knee. She's going to loop it around her foot, and she's going to lay straight back. So what we are doing is trying to lengthen the hamstring. So she is going to straighten the leg out. The band is naturally going to give her resistance because it's around her waist. She's going to keep this leg locked, and she's going to drop it down and come up. This leg is going to be straight, flat up against a wall or your couch. And she's going to go to where she feels resistance. So she's going to go down all the way and up to tightness or pain. If pain hits, then you're going to back it down a little bit. So 10 of these, straight leg. Once she hits 10, she's going to bend the knee, and she's going to pump the heel towards the ceiling. Each time she's going to lock that hamstring out. Okay? Our goal is to keep progressing her further and further and further. As you do this, by 6 weeks, your range of motion should be up to here, unless you have a hip or a knee condition that prevents that. 10 of those. Then she's going to take it out to the side, keeping her hips level, bend the knee, pump it out. She's going to do 10. Once she does 10, she's going to rotate it around here, bend the knee, and she's going to pump it this way. You're going to feel the pull through here, and we're going to get 10 of those. Then she's going to rotate it like this. She's going to bring up this other leg and put it right here, and it's going to target the glute. She's letting go of the band, just allowing the body to relax. At this point in time, we're almost finished with the resistance band stretching, so she's going to sit up, keep that attached. She's going to get the band out from around her, so the easiest thing to do is probably scoot it underneath, but she's going to keep it onto the foot. And for demonstration purposes, we're going to actually switch feet, but for you, I want you to keep it on, and she's going to hold it in her arm up here, and you're going to roll to this side, roll all the way to that side. This knee is going to now be bent. The bottom knee is going to be all the way flexed as well. And she's going to take it right above your shoulder, just like this. And what we're doing is we are lengthening her hip flexor or psoas. If you have an arthritic knee or knee replacement, don't do this. If your hip is replaced, don't do this. But she's going to hold that for 15 to 30 seconds, work up to a minute. It's going to release this. If this hurts, or if I drop her knee down and it doesn't want to go down, let one of us know, and one of our soft tissue specialists will clear this out, allow you to improve your range of motion. This is targeting the psoas. After she's held that for 30 seconds, she's then going to do the other side and repeat that 3 times. So, since we're talking about psoas and lengthening this muscle that is connected to the low back, this is where the ball comes into play. So she's going to lay on her back. She's going to allow it to sink right into her abdomen, and she's just going to apply pressure. This should not go dead center. It's going to go off to the side, just above your hip bone, and you're going to sink it straight in. Okay? Just a little bit of pressure would go a long way. As you progress, go ahead and roll to your belly for me. You're going to target this ball right into the abdomen, and you're going to allow that to sink in there. And you're just going to let your body weight sink directly into there, and as it progresses, that muscle and tissue is going to soften and loosen up. So that's the mobility, that's the stretches. So now we're going to do some exercises. So from here, get on your hands and knees for me. We're going to do what we call a fire hydrant. So with a fire hydrant, you're going to think of a dog that's peeing on a fire hydrant. So she is going to lift up this knee off the ground and kind of open up as much as possible. Now what we don't want to see is her rotating all the way, because it's going to torque the spine, it's going to injure you. You want to keep neutral spine and raise it all the way up. Very good. You're going to do 10 of these on the left, 10 on the right, and progress by 10 each week. So 10, 20, 30. By week 3, we should add a resistance band and go into phase 3. Go ahead and do a hip extension now. Keeping your core tight. She's going to go straight back. The back stays neutral. And see how she is really hyperextending this? I want you to keep it a little lower, drop it down, back to neutral, so that she was demonstrating the way that most people will want to initially do it. Come back. Perfect. Activating the glutes, getting them nice and tight, not bringing it up because it's going to pinch and it's going to hurt. So we're going to do 10 of these, activating the glute, keeping the core tight. Both sides. From there, you're going to lay on this side again for us. Bend your knees. This is called a clam. So with the clams, you're going to open your hips up, keep your feet together. You're going to open your hips up, and it's like a clamshell opening up, basically. We're going to do 10 of these. Ideally, we're going to get her to full range of motion without her trying to rotate her hips to cheat. So we're going to do through here just like this, 10. Same progression, 10, 20, 30. By week 3, it should be strengthening. We should be able to add a band. From here, she's going to rotate to her back. Knees are going to stay bent. She's going to lift her hips right off of the bed. So lift up, squeeze the glutes, hold it for 1 second, drop it down. This is called a glute bridge. Raise up, 1 second, back down. Start out with 5 of these in the morning when you wake up, 5 when you go to bed, and progress to 10, 20, 30. From here, I'm going to have her stand up, face that, and we're going to have supplied you with a resistance band. So if you watch the first welcome video, we showed you the 3 different ones. She has progressed well enough that she doesn't need the smaller resistance band, but you might, and we'll prescribe you the right one, and you can go through these as you progress. So she's going to stand on the band, feet 6 inches apart or shoulder width apart. She's going to, this is called an X band walk, but we're not going to X band it yet. So you're going to pull your up just above your waist, bend your knees slightly. You're going to step 6 inches to the right, and you're going to bring the left legs back to neutral. Go to neutral, left leg. There you go. So let's do it again. So if you can hear her foot squeaking or dragging, she's doing this on purpose. It's for demonstration. This is what you're going to experience. It's much more difficult than what you think. So knees are bent. You're going to step to the side. You're going to lift your leg up and reset to neutral. Now come on back into the camera view. No foot drag. If there is foot drag, you cannot progress from 10. I want you to be able to do 10 to the right, 10 to the left. If there is foot drag, we're going to drop you down a resistance band. These bands are going to go above the knee. We'll walk you through this. These are your low back pain exercises for phase 2.